Hello guys, hope you're all okay, you're all enjoying your life and you're also enjoying watching my ultrasound video. Today I have selected the topic, and that is related to day-to-day radiology. You're all doing ultrasonography and you're all doing the abdominal ultrasound, quite common, and you come across with the spleen. You measure the spleen. If it is splenomegaly, you document that as a splenomegaly. But the one important thing, which is congenital abnormalities related to the spleen, the one congenital abnormality is splenunculus. Quite often you confuse with, either you label it as a mass at the hilal region, but actually, or in fact, this would be a spleniculus, and you can confirm it on the CT images, taking the CT density, and you will find that this is the density similar to the spleen. Splenoculus is actually ectopic splenic tissues, and that appears to be a very round mass and at the area of the hilum. So far the wandering spleen is concerned, you cannot exactly see on the ultrasonography, but there are some other patterns as well, like splenosis. After the traumatic rupture, some of the splenic tissues goes elsewhere and it start proliferating there. That would be called as a splenosis. And there will also be another abnormality which is called as a splenogonadal fusion. You must keep that in mind as well. So these are the few congenital abnormality. Just for the revision purpose, I have mentioned that, but particularly I have selected the image. Either I would say selected a video. On the video I have selected the spleniculus video, so you will see that how the spleniculus appear on the ultrasound imaging, how you will take the measurement, and how you will mention it on the report. So this is a congenital variant, nothing to worry for. This is not the tumor, this is not the neoplasm, or this is not the mass. You should mention that this is similarly to the spleen, and you can write quite confidently that this is a spleniculus. If you have any doubt, you can mention that it's suggestive of spleniculus, but for further confirmation you can do the CT scan. If in case that you doubt something abnormal will be going with the patients and the history will support the some weird phenomena or other pathology, so that in that case you can advise the CT scan. But otherwise, if you come across with a normal human being without any symptoms, and you can find the small mass lesion at the hilum with the same echogenicity, just mention that this is a spleniculus. So let's start watching this video. Well-defined spleen is visible at the hilum. You can appreciate a well-defined nodule of same echogenicity, and it is spleniculus. Should not confuse with the mass. Do not label it as a mass. This is congenital and this is called as spleniculus.